I should say good day to everybody. Uh, we are now shortly going to start this webinar. Welcome everyone. As a brief introduction, I'd just like to say that my name is Madhushri Shekhar. I'm a professor at the I'm a professor at the Center for the Study of Social Exclusion and Inclusive Policies, and also currently the chair of the International Relations Office at Tata Institute of Social Sciences in Mumbai. I will be your moderator for today's webinar on examining social protection among vulnerable groups during COVID-19. Thank you very much, everyone, for joining us today. This is the second webinar in the webinar series on the narratives of COVID-19 from the social science communities in India and the Philippines, jointly being organized by the Philippine Social Science Council, or the PSSC, and the Indian Council for Social Science Research, or ICSSR. ICSSR, just briefly introduce all the speakers to our two main organizations. ICSSR was established by the Government of India to promote research in social sciences in the country. It provides grants for projects, fellowships, international collaborations, capacity building, surveys, and publications to promote research and so in social sciences in India. PSSC is a non-profit organization of professional social science associations and social science research and instructional institutions in the Philippines. It has 14 regular member associations representing various social science disciplines and around 40 associate member institutions. To officially begin the event, let us hear first from the Executive Director of PSSC. She is a professor of communications at the UP Dillon College of Mass Communication and was also the former chair of the Board of Trustees of PSSC. She also served as a college secretary of the UP CMC, chair of its communication research department, and special assistant to the president of the UP system. Ladies and gentlemen, welcome Professor Lourdes Porteous.
Thank you, Professor Madhushri Shekhar, for that kind introduction. Dr. V.K. Malhotra, Member Secretary of ICSSR, Dr. Mahesh Madhukar, to our most distinguished speakers and reactors from India and the Philippines. They will be formally introduced later. Officials, members, and staff of the Philippine Social Science Council and the Indian Council of Social Science Research. To our live audience and viewers on FB, Twitter, and Zoom, friends, ladies and gentlemen, good afternoon, Philippines, and good morning, India. On behalf of the ICSSR and the PSSC, I warmly welcome you all to the second of a series of webinars that ICSSR and PSSC have agreed to organize as a result of the Memorandum of Understanding penned between them in August 2020. We launched the collaboration between the two countries last August 20 via the first webinar held last October 15, 2020. It aimed to deepen the discourse and provide a different perspective on the role of social scientists, especially during the COVID-19 pandemic, and focusing on their work, stories, and experiences. Today, we hope to gain a more profound understanding of social protection among the vulnerable groups during COVID-19. What are the experiences of the vulnerable populations from the two countries during the pandemic? What areas of effective social protection systems should the policymakers be looking at? When crisis hit, it is the poor and the vulnerable groups that suffer more. However, there seems to be a limited coverage of social protection afforded to them, especially in this time of pandemic, that the need to upgrade such protection has become more urgent. How much has the government allotted for the protection of the poor and vulnerable groups? What social safety nets are in place to stem off further dive into poverty and restore income, livelihoods, and compensate for price hikes? Are pension payments sufficient, especially for the elderly and persons with disabilities? Are their healthcare needs and costs of living taken care of? I know that India provides good examples related to digital pension payments, and it would be good to know its experience as well as how the Philippines is faring in doing the same. According to International Labor Organization's Social Protection Department, nearly 40% of the world's population has no health insurance or access to national health services. Some 800 million people spend at least 10% of their household budget on healthcare each year, and 100 million people fall into poverty because of medical expenses. This means that many simply lack the means to seek treatment when they are sick, including when they have highly contagious diseases like COVID-19. What about sick leaves, unemployment protection, and unemployment benefits? We hear these benefits availed of by workers from first world countries. But do we also have this in India and the Philippines? We know that the 2030 Agenda for Sustainable Development includes universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. There are other targets that provide for more social protection. How far are we in achieving this? I have more questions, but let us just hear from our speakers who may shed light on these issues. But before we do so, may I invite everybody to the third installment of the ICSSR and PSSC collaboration. It will be about understanding economic stimulus packages during COVID-19, and we shall let you know of the details as soon as these are available. I would like to end by quoting an ILO news from Geneva, and it goes like this. If the COVID-19 pandemic has sent the world one message, it is that we are only as safe as the most vulnerable among us. Good day, everyone, and thank you. Mabuhay and namaste.
Thank you, Dr. Porteous. I'd like to welcome Professor V.K. Malhotra. Professor V.K. Malhotra is presently the Member Secretary, Indian Council for Social Science Research, New Delhi. Professor Malhotra is a professor of economics and has held many important positions in the university administration. He has supervised many theses of PhDs and MPhil scholars. His research interests include governance and economic development, corporate governance and performance of various industries, intellectual property rights, and India's developmental concerns. Foreign trade and investments are some of his interest areas. He is on the governing board councils of a number of reputed national and international organizations and has been involved in the development of new institutions and new research schemes. Welcome, Professor Malhotra. To you, Professor.
Please unmute, Professor.
Okay, please. That's right. Thank you. Thank you. Thank you, Dr. Madhushree Shekhar, for accepting our invitation to be the moderator of this part of our webinar series, in fact. As Dr. Porteous very rightly said, that ICSSR and Philippine Social Science Council entered into MOU a few months back only, and then we decided to begin with, especially in the face of the current situation at the global level, we decided that let's start a series of webinars. And we did decide that in October, November, and December, in these 3 months, we would have 3 webinars. So first of the series happened on October 15th on examining the COVID-19 response of India and the Philippines. That was the first. And now it is our second webinar, which is collaborative in nature, and that's on examining social protection among vulnerable groups during COVID-19. And our third webinar of this series will be held in December sometimes, and that will be on economic stimulus packages all around the world and our own experiences related to those economic stimulus packages. I'm also thankful to the contributors from Philippines, Dr. Judy Taguivalo and Dr. Rosalinda of Ranio. Dr. Judy would be making a presentation from PSSC site, and Dr. Rosalinda will be the reactor on that presentation. From ICSSR side or India side, Dr. Rameshan, who happens to be a member of Niti Aayog, and he has contributed immensely in the field of agriculture, agriculture-related reforms, and many more policies at the national level, and has been part of the think tank at the global level also, will be making presentation from India side. And Dr. Arvind Virmani, who again has been part of the several international think tanks, will be the reactor from India side. And thereafter, Dr. Madhushri will be taking few questions. If we are left with some more time, she'll be taking few questions for the presenters. And then we would have the summarization of this webinar. Just to be very brief about the things, I remember that ICSSR itself launched a call sometimes in end April and early May on COVID-19 itself, and we received a very tumultuous response from the country, received almost 1,300 applications, which we were processing, of course, and we are taking these applications as far as award process is concerned a little forward, though at a slower pace than expected of us, understanding the situation, and maybe even those who would be appearing for their presentation, they do not find themselves in a very comfortable situation to come out quickly for all these interactions and presentations these days. But still, I am very hopeful within next 2 months, we would be in a position to finalize the award process related to COVID-19 studies in India. And through that, we intend to do a health survey or a health survey in connection with India. Another interesting fact is that our things have been noticed at the global level, and UN Deputy Secretary General Amina Mohammed also gave a call for UN research roadmap for the COVID-19 recovery, and they identified 5 dimensions. The second dimension among those identified 5 dimensions is the social protection, on which we would be having our deliberations and presentations today. I'm very happy to share with you that UN research roadmap, in which ICSSR happens to be the co-chair on social protection roadmap, it has been released and accepted by the UN, and it has been released few days back itself. So I'm showing it before the camera for so that you may all see that it has been launched a few days back, and ICSSR's contribution in that, especially in connection with the social protection, has been recognized as far as the research roadmap is concerned. So I leave the floor for our very learned speakers now, and I'm very sure that all of us would be benefiting from their very valuable and erudite presentations and deliberations. Thank you very much.
Thank you, sir. Thank you, Professor Malhotra, for this very nice introductory remarks. Now we move into our presentations as well. Let me just briefly introduce our first resource speaker for this session. We have as a first speaker, Dr. Judy Takuala. She is a professional lecturer at the College of Social Work and Community Development of the University of Philippines, Diliman, where she was a full professor until her retirement in 2015. She has previously served as secretary to the Department of Social Welfare and Development of the Philippines from June 2016 to August 2017, and as the director of the University of Philippines Center for Women's Studies. At present, she is a member and one of the spokesperson of the Citizens' Urgent Response to End COVID-19, a network of grassroots organizations, professionals, and individuals involved in addressing the health, economic, and rights impact of the pandemic. Dr. Takwala also works with various civil society organizations, including IBORN Foundation, as board member and the convener of the campaign against the return of the Marcoses and martial law as convener, and the Asia Pacific Forum on Women, Law and Development as member. Welcome, Dr. Judy, to you.
Thank you very much for that kind introduction. I'm going to try to share screen. Okay. Okay. Okay, I'm still trying to share screen now. Okay, oops, not that one. Okay. Okay, I got it. I'm so happy to be able to screen share with you this afternoon. So, good morning to our colleagues in India. Magandang hapon, good afternoon to our colleagues here in the Philippines. My presentation is on examining social protection in the Philippines among vulnerable groups during COVID-19. My flow, the flow of the presentation is the following: a brief background of the vulnerable groups in the.
Excuse me, Dr. Judy. I think you
Yes.
have not on the you have not put up your presentation. It has to come on the screen. We are seeing your screen, but your PPT is not come on the screen.
Okay, you are screen sharing.
Yes, and you need to on your presentation, ma'am.
Okay.
I think.
Is it
Yeah.
there?
Now you got it. Yes. Now you have to put
there
it on
now?
the full screen mode.
Okay.
Just have to go.
Okay.
Yeah, thank you. Yeah, thank you. Thank you very much.
Oh, thank you also. I'm so happy to be doing it myself. So again, good morning to our colleagues in India, and magandang hapon, good afternoon to our colleagues here in the Philippines. My presentation is on examining social protection in the Philippines among vulnerable groups during COVID-19. The flow of the presentation is a brief background on vulnerable groups in the Philippines and the social protection programs prior to COVID-19. Next would be the COVID-19 official response, which I call late, limited, and militarized. And then the focus on the social amelioration program as response to the economic crisis. So the social protection aspect in the times of COVID-19, a short critique of the social protection policies, and then, one slide of my conclusion. Okay, so I would just like to reiterate that the Philippines is a rich country with vast economic and social inequality. We are very rich in natural resources, fertile agricultural land, abundant mineral deposits on land, and offshore fish and other aqua foods from fresh and seawater abound. But economic and income inequality continues to characterize the country. Philippine income inequality as measured by the Gini coefficient is 45% and is considered as one of the most unequal in the world. The income inequality is also evident in the income gap between the top 500 income earners in the Philippines, who earn an average of 400 million a month, while the minimum wage for daily laborers is only 537 pesos, or an average of 11,814 or 300 US dollars, while for the top 500 income earners, it would be around 800,000 US dollars a month. This is based on the income tax filing of the top 500 in the country. Of course, income-based poverty measure is not sufficient to capture the multidimensional character of poverty in the Philippines. Access to social services, especially health, education and housing, political participation, quality of employment, vulnerability to violence, and social security are some elements of well-being not captured by income-based poverty measures. We have high unemployment and underemployment data. Official government statistics place unemployment and underemployment rates on July 2019 at 5.4% and 13.6% respectively prior to the pandemic. It would get worse, of course, with the lockdown starting March 15. But there is a social protection program in place. The Planning Agency of the Philippines defines social protection as policies and programs that seek to reduce poverty and vulnerability to risk and enhance the social status and rights of the marginalized by promoting and protecting livelihood and employment, protecting against hazards and sudden loss of income, and improving people's capacity to manage risk. This is the NEDA Social Development Committee resolution in 2007. Who are the vulnerable groups? Again, the same document defines the vulnerable groups as the inherently vulnerable, who are the poor and transient poor, children, women, persons with disabilities, indigenous peoples, overseas Filipinos and their families, and older persons. Even non-vulnerable groups also face economic risks such as low and irregular incomes and financial economic crisis. Other risks are brought about by environmental and natural hazards and governance and political risks. And right now, we have seen the additional risk brought about by the global pandemic, a health crisis. What are the key social protection programs of the government? So we have the Social Assistance Program. This is the Pantawid Pamilyang Pilipino Program, or the Conditional Cash Transfer, and the Social Pension Program for the older persons, 60 years old and above. Social insurance, we have both the retirement pension from the private sector and the government sector. It is contributory. Another insurance system is the PhilHealth Insurance Program, which is both a social insurance for employed Filipinos who pay monthly contributions, and is social assistance for citizens aged 60 and above, and those considered indigents who get free coverage. Philippine official document notes that while social protection mechanisms are in place, these remain inadequate. Programs like conditional cash transfers, health insurance, social security systems, and income and livelihood support have been existent but have limited coverage and benefits. I'll just run through this part. I was supposed to have eliminated this because of the time limit. So we have the 4Ps, or the conditional cash transfer. There are around 4.4 million household beneficiaries considered poor. It is conditional to the family attending family development seminars, health checkups, and school attendance. It provides a household with 3 children around 1,400 every month, or a total of 15,000. You have to have children below 18 years old to qualify for this. It is not enough that you're poor, you have to have school-aged children. And then you have the social insurance programs. An organization of the elderly cited 2018 government data saying that 75% of the private sector pensioners and almost 25% of public sector pensioners receive monthly pensions below 5,000 pesos, or around 100 US dollars. You know. That's not even enough for the maintenance medicines of the elderly. The social pension is only 500 pesos per month and is limited to frail, sickly, or with disability. If you receive any amount of financial compensation, whether it's as small as $10, then you are disqualified. There is also major delay in the distribution of the limited amount. PhilHealth program is presented as a platform for universal healthcare. It is supposed to have a 90.5% coverage. However, household survey revealed that only 67% of those interviewed were covered by the health insurance program. Aside from the limited coverage, it's also limited subsidy. A study has revealed that out-of-pocket costs for health expenses is around 54% for the individual, for the patient. Okay? The COVID-19 pandemic impact on health and livelihood. So we have been in varying forms of lockdown and intensity of restrictions. They call it enhanced community quarantine, general community quarantine, modified general community quarantine, under the rubric of community quarantine have been put in place since March 15, 2020, and are still in place in the country, giving the Philippines a dubious distinction of having the longest lockdown during this pandemic. We continue to have fresh cases of COVID infection every day. Although it has dropped from an average of 2,517 a month ago to 1,887, the daily cases announced are still 4 digits. We are second to Indonesia in the number of COVID cases in the ASEAN region as of November 16 data. But we have a higher number of cases per million population compared to Indonesia, partly because I think it is the COVID testing in Indonesia is less than in the Philippines. The economic impact, so we have joblessness, poverty, and the people going hungry. Government places joblessness at around 4.6 million jobless individuals last July, and the all-time high of 17.7% or 7.3 million people recorded last April. The underemployment rate has not been shared here, but it's also very, very high. Poverty data, I have only the December 2019 data from a survey on self-rated poverty, show that 54% of respondents, or around 13.1 million families, consider themselves poor. Like self-rated hunger in May 2020, this number is also the highest since September 2014. So the optimistic projection of Philippine poverty rate falling below 20% by 2020 is obviously not going to come true. Increase in hunger, highest hunger incidence of 30.7% since the previous record of 23.8% in March 2012. This is based on a survey done in September 2020, which found 7.6 million households hungry due to lack of food at least once during the coronavirus pandemic. The official COVID-19 response, limited response for the whole month of January. While we had our first case on January 31, the prohibitions and restrictions were only put in place on March 15, or over 2 months since the global pandemic started. It has also been a militarized response between March 17 and June 8, the arrest by the police of a total of 193,779 people for quarantine violations. Of this number, it charged 58,848 and detained 15,307. As of October, 2,637 remain in congested jails. There has also been the closure of a major network believed to be critical of the government, the ABS-CBN, as well as the passage of an Anti-Terrorism Act of 2020 during the height of the COVID-19 epidemic going on. So the Social Amelioration Program as a response to the economic crisis. Philippine Congress passed Bayanihan to Heal as One Act, March 5, 2020. Bayanihan means working together in the Philippines. It authorized the President to exercise powers necessary to carry out urgent measures to meet the current national emergency. It allowed President Duterte to realign, and reprogram a budget of almost 5.37 billion US dollars from the estimated $8.55 billion national budget approved for 2020 in response to the pandemic. What are the components, the windows of social assistance in the time of the pandemic? There are several. The Social Amelioration Program under the Department of Social Welfare and Development, which extended 5,000 to 8,000 per qualified household for 2 months, theoretically for 2 months. In reality, only 1 month for the qualified beneficiaries. The second tranche was for select beneficiaries. And then you have assistance to displaced workers under the Department of Labor and Employment, cash for work, minimum wage for 10 days of disinfection and sanitation work of their dwellings and immediate vicinity. Another Department of Labor initiative, Abot Kamay ang Pagtulong or AKAP. This is a one-time financial assistance of 10,000 pesos to land-based and sea-based overseas Filipino workers who were displaced during the pandemic, and there have been hundreds of thousands who have come home because of the pandemic. And then you have the CAMP. This is a financial support for workers regardless of status employed in private establishments nationwide whose operations are affected due to the coronavirus. And then a financial subsidy for rice farmers, 5,000 pesos each to rice farmers who till 1 hectare and below. So it's very limited to really, really small farmers. And it's a one-time grant of 5,000 pesos. A small business wage subsidy of between 5,000 to 8,000 pesos based on the regional minimum wage per month for employees of micro, small, and medium enterprises who have to close down during the pandemic. While a study states that the Philippines has been able to roll out a massive emergency social protection response to the COVID-19 lockdown with near universal coverage of possibly more than 90% of the population, the actual government cash assistance of around $100 to $160 or 1 to 2 weeks worth of minimum wage was clearly not enough for households without sources of income because of the strict lockdown. Ibon has this computation for DSWD, the Social Amelioration Program, 17.7 million beneficiaries for the first tranche, 13.9 million beneficiaries for the second tranche. For the Dole Camp, one time 5,000, this is for almost 700,000 beneficiaries. And then you have the minimum wage per region for 10 days for informal workers. This is the cash for work program. Around 340,000 benefited from it. And then you have the Dole grant for returning overseas Filipino workers, 10,000 pesos. For the rice farmers, of 5,000 pesos, around 600,000 benefited. And for the employees of micro, small, and medium enterprises, it's similar to the Social Amelioration Program for 2 months, another 3.1 million. It seemed like a lot, but not all targeted received. What was received was too little, approximately 5 to 9 pesos per family member per day over March 15 to October 22. My critique of the social protection, The pandemic has further aggravated the already serious problem of economic and social inequality in the country and the inadequacy of the country's healthcare system. Under this condition, immediate, sufficient, and humane assistance to the government, whether called social protection, social amelioration, is a necessity. It provides some level of economic relief to the millions already poor prior to the pandemic and to those who lost jobs and livelihood because of the lockdown. But social protection itself should only be a stopgap measure if structural inequalities are addressed and the majority of the people have sources of livelihood that allows them a decent life, and if social services such as health, housing, and education are accessible to all. There are several issues related to the social protection programs in the Philippines. One of them would be the administrative issue. Administrative issues around which were raised before the pandemic were spotlighted under the health and economic crisis. So it is the targeted social protection, which requires a system of identifying the poor and separating them from those who are not. Obviously, the 4.3 million poor with school-age children under the conditional cash transfer program do not comprise the universe of the poor in a country with vast social inequality. In fact, the 18 million families and later raised to 21 million families as beneficiaries of the Social Amelioration Program or SAP required a new system of identification, which further delayed the distribution of much-needed cash assistance during the pandemic. And the targeted distribution and the targeted beneficiaries prevented social workers from providing house-to-house assistance because neighbors who were not who were not beneficiaries would go after them. That's why you have this violation of social distancing during the distribution. It's also true for other forms of ayuda, such as a social pension assistance for older persons, which requires a system targeting and excludes those with pension no matter how small the amount. Social protection is also a political issue. Who receive what and how much is decided by a process vulnerable to political intervention. The politicalization of social protection programs, the targeted one is not limited to the distribution at the village level, where local officials can decide on the location and the manner of distribution. At the very top, national officials at the executive and legislative level decide on the allocation of assistance to various sectors and groups. Because targeting is vulnerable to manipulation, inclusion and exclusion can be determined by politicians. Social protection is also about the failure of economic and development programs to truly address the vast economic and social inequality in the country. The National Anti-Poverty Commission, a government agency, in its policy paper pointed out that, quote, the main limitation of the social protection measures is that many of them are residual in the sense that they simply serve to mitigate some of the worst impacts of macroeconomic policies that have resulted in increased impoverishment without inviting interrogation of the main development strategy that led to increased poverty in the first place. A case in point is the 2018 Tax Reform for Acceleration and Inclusion, or TRAIN law, which reduced individual and corporate income taxes that benefited many big corporations, but increased indirect taxes, which the country's poor shouldered as consumers. Alternatives. As an incoming Social Welfare Secretary in June 2016, I shared my trust for the Department of Social Welfare Development. The first one was continue and improve social protection programs that aim to provide immediate relief and timely assistance to the marginalized and vulnerable sectors of the country. This include the conditional cash transfer program. However, these programs will be complemented by initiatives that will help the poor stand on their own through jobs, asset reforms, and other through people, economic, and social reform initiatives. A shift from targeted social protection to universal provision of social services shall be studied and endorsed. The Philippine Development Plan of 2017-2022 actually adopted that formulation, a universal and transformative social protection, and listed one of the strategies as the adoption and institutionalization of a social protection floor, which the ILO describes as typically including but not limited to cash transfers for children, maternity benefits, disability pension, support for those without jobs, old age pensions, and access to essential health care. While the Philippines legislative and executive initiatives would include all these categories, the coverage is far from adequate and far from universal as they exclude majority of the population, especially those in the informal sector. The alternative to targeted social protection would be a progressive taxation system that targets the wealthy more than the middle class and the poor, an economic trust that prioritizes the domestic economy and markets in order to create local jobs, and an increase in social spending that will enable the realization of universal social services accessible to the poor. The proposed 2021 national budget does not respond to the call for progressive taxation system and increase in social spending. This budget is still being deliberated, but already corporate taxes will be further reduced through the train to or create legislation. Indirect taxes will be increased. Allocation for health and social welfare programs will be reduced. Priority spending will still be on infrastructure and on military spending. I have a last slide, which is not included here. My conclusion, the quest for social protection cannot be separated from the quest for social justice, which would include progressive taxation system and prioritizing social services. And as past social justice victories have shown, it is through organized and collective action of the people that changes are realized. Academics have a role to play as we join our scholarship and advocacy with grassroots initiatives and demands for social justice. Thank you very much, and good morning and good afternoon to everyone.
Thank you very much, Professor Judy
Okay.
Takpala. That was a really, really very, very insightful presentation of the social safety initiatives that we could hear looking at the Philippine experience. Let us now hear the insights and reactions of Dr. Rosalinda Ofrenia. Dr. Ofrenia is currently a full professor at the College of Social Work and Community Development of the University of Philippines, handling overseas in the handling courses in the Doctor of Social Development program and the Department of Women and Development Studies. She has a bachelor's degree in home economics and a master's degree in communication and a PhD in Philippine studies. She and all from the University of Philippines in Diliman. She has published many works and researches on topics such as social protection, globalization and women's work, subcontracting and house-based work, child labor, women's workers in the export process, and has worked a lot in the work in women in the informal economy, women in debt and poverty, women and literature. She has been active in the women's movement for 4 decades and is currently president of HomeNet Philippines and regional coordinator of HomeNet South Asia. Welcome, Professor Rosalinda.
Professor Madhushri, just for a minute, Professor Madhushri.
Yes.
Professor Ramesh Chand has to leave for a meeting with Ministry of Finance immediately. So
okay. So then we will
please have him first.
That would be. And if I could request Professor Rosalinda to just please bear with us so that Professor Ramesh can make his brief presentation. It's my real honor to welcome Professor Ramesh. Can I just take 2 minutes to introduce Professor Ramesh to all the audience? Professor Ramesh Chand is a renowned Indian agricultural economist and a policymaker of repute. Over the last 3.5 decades, he has been actively involved in food and nutritional security related agricultural issues since 2015 and has been a member of the National Institution of Transforming India, Niti Aayog, in the rank of Union Minister of State Government of India. So formerly Niti Aayog, formerly known as the Planning Commission of India, which is the policy think tank chaired by the Prime Minister of India. In his position, Dr. Chand directly steers India's agriculture development agenda and with major focus on food and nutrition security. He also provides policy-related inputs to the ministries, both of the central and the state governments, concerning land, water resources, SDGs, poverty alleviation, forest environment, sustainable livelihood, smallholder development, food processing chain. Dr. Chand is currently responsible for India's vision, strategy, and action agenda for agriculture sector, including government's flagship agriculture program for doubling farmers' income. Welcome, Professor Jay. It's an honor to hear you speak.
Thank you. Thank you very much, Madhu.
Thank you, sir. Thank you.
Friends from Philippines, Dr. Judy, Dr. Rosalinda, and others. And from India side, Professor Malhotra, Dr. Burmani ji, and I see a couple of other faces in ICSSR seminar hall. Sorry, I had to create some, I think, disturbance in the program, because I can stretch my presence in this seminar maximum up to 12:45 and then rush to North Block. Madam Judy has very ably given, I would say, theoretical background why social protection is needed, what kind of social protection measures are in vogue in different countries. I will not go into that. I will specifically come to the social protection measures in the time of COVID epidemics. Like Philippines, in India also, we have a large set of social protection program, but I have observed from my experience during last 10 months after outbreak of COVID epidemic, that two most important social protection program which has played significant role in addressing vulnerability, poverty, and others. They were first social protection program relate to ensuring availability of food, and second social protection program is around ensuring some minimum work availability to the unskilled laborers. So coming to the first social protection measure, maybe our friends in Philippines know about it, that we have a system of food security which has 4 pillars. The first pillar is that we announce some remunerative price for the farmer. Second is the procurement. Third is the buffer stock, and fourth is the public distribution system. So this system is in place since mid 1960s, and I do not have time to elaborate that whenever we got any big shock to food supply, this our system of 4 pillar of food security has really been a great rescuer, and it has protected India from a serious setback to the food security. I view this program in a larger context, that the shocks that any country faces can be of 2 types. One is that local or regional. Second is global. If any shock is local or regional, you can address it by relying on other country, by relying on global markets, global resources. But if a shock is of a global nature, then I feel that it is the local capacity, local institution on which you have to rely more, because entire globe is affected by a shock, and they may not be able to help you in this situation, like if you have a local kind of shock, so you can drop from the global sources. The immediate shock which comes to my mind before COVID is the global food shock. So we have seen at that time how Philippines suffer, how other countries suffer, and almost all countries faced skyrocketing of food prices. And there was some sort of restriction put on trades. So you could not rely on global supply chain, on global production to meet your food needs. So at that time, I did a study for Food and Agriculture Organization, which is published by them, which is published in India also, that in order to address the shocks of global nature, you need to have a local capacity, and that local capacity in the case of India was its buffer stock of food grain. And the lesson from that is that you can't create such capacities in response to a crisis. These capacities have to be there before the crisis strike a country. So that is very important lesson, that now there is a COVID, therefore you will have this kind of buffer stock. No, that buffer stock has to be there before COVID. Of course, reasonable kind of buffer stock, not excessive kind of buffer stock. So that paper was appreciated. And then later on, ASEAN also organized a conference in Japan, where they invited me to present that paper and what are the lessons of that for Asian countries. That if you want to safeguard against any global shock, then maintain some reasonable level kind of buffer stock. It will not be possible to rely on global supply chain at that time. So now after global food shock, we are, and the lesson of that was that while the prices were rising in all other countries, in the case of India, during the period 2007, 8, 9, 10, the food inflation was lower compared to the previous period and later period. So this is how that buffer stock policy helped in case of India along with PDS. Now coming to this present global this epidemic, which is having much higher severity than the global food shock, and we found that because we had adequate stock and we have a very well established network up to every habitation in the form of public distribution system, so this has been of great help to protect our population falling into severe hunger or hunger. And normally we are giving 40% of the staple food requirement through public distribution system at a throwaway price, at just a throwaway price that only in India it is 2 rupees and there are 74 rupees in $1. So we are giving that 1 kg of staple food for just 2 rupees and 3 rupees to 2/3 of the rural population. So that is the kind of coverage. And since we had adequate buffer stock, we increased it from 5 kg to 10 kg for certain period. And if you do the total calculation, you will just find that those who were entitled for this food safety net, they got 80% of their total consumption of food staple. The average consumption in India is about 10 to 11 kg of all the cereals, and through PDS we supplied 10 kg of rice and wheat plus little bit of grain legumes because Indian diet is such that you need some sort of grain, legume, some sort of curry also. So this way we met almost 80% of the staple food requirement of total half of the population, but 2/3 rural and half of the urban population, and total 2/3 of the population overall in the country. So I would like to share this with my friends from Philippines that this has been a great savior, and this has really protected India from falling into a very, very serious global hunger trap. And you know that we witnessed the largest short-run migration, that people from urban places, rural places, they went back to their native places where there was no work. But it was ensured that all of them get the adequate food supply under this public distribution system. So this I would place as number one safety social protection measure during the COVID time. The second is, as I said, related to work. We have a National Rural Employment Grantee Scheme. That is a scheme where the entitlement is as per the self-selection. Anybody interested to get 100 days work at some specified wage rate can register himself or herself with the local we call them panchayat. They are the local self-governance bodies, and then work is provided for 100 days. We are not able to reach 100 days in every state. Somewhere it is 70 days, somewhere it is 80 days. Somewhere where states are well-to-do, like Green Revolution states of Punjab and Haryana. So it is not needed. So it is not much there. So then, under this National Rural Employment Grantee Act, this was further strengthened during Nrega time, and all those people who migrated in very large number from their workplaces to their native places, to their places of origin, you can't suddenly get work because now you have come there. So this Nrega, National Rural Employment Grantee Act, proved to be, I would say, the second most important social protection program during the COVID shock. The third, which is not a social protection program, but which is more related to what kind of policy should be there, because I feel that we should not rely only on the programs for social protection. We should also look at policies for social protection, which also matter as much as the actual program matters. And since the migration happened from both rural and urban area to rural area, the migration did not happen from urban to urban. So laborers who were staying in one state, another state, so they went back mainly to their rural roots, not to the town. It was very, very less. But mainly the labor class went back to their rural places. And in rural area, 60-70% of employment is in agriculture sectors. So we in India ensured through proper policies, which I can say are in the nature of social protection policies, that all kind of exemptions are given to agriculture from the restrictions which were put during COVID time, like lockdown, people can't move out, etc., etc. So we just worked very, very hard for the day we announced lockdown. It was, I think, 23rd March. But from 25th March onward, we started issuing advisory to all the states. Please keep agriculture outside these restrictions. Number one, nature of agriculture operation is such that there is a natural social distance. People are not in close contact. So chances of infection getting spread through agriculture activity is much, much less compared to infection getting spreading through industrial activity or service activity. So agriculture was given exemption, and so much so, people from urban area were moving to rural area to do some work and then come back to urban area. So this, I would say, is the third very, very important, though it is not named as social protection policy, but that was the main idea behind giving exemption to agriculture sector, that we need to ensure that agriculture activity do not get disrupted. And as a result, our growth rate of overall economy, about which Dr. Birmani is the master, he is the first person who wrote paper on what will happen to our economic growth, our production, our GDP because of COVID. A wonderful paper. I recommended it to a large number of people, and they all gave me very good comment and thanked me for sharing that paper. Instead of thanking Birmani ji, they thanked me. So Birmani ji, I earned some of the credit which belongs to you. So he has nicely done those calculations. But the message which I want to give is that while our non-agriculture sector in the first quarter after COVID struck India was of the order of 1/4, -24%. But growth rate in agriculture sector was better than what it usually used to be. So it did not decline, it did not become stagnant. It was 3.6%, which was slightly better than what was earlier. So I feel that if this economic activity was not protected, if it was disrupted, we would have faced a catastrophe in rural India. So by giving timely exemption to agriculture sector and ensuring that nobody stop any farmer or any agriculture labor going to field working there, no check on agriculture machinery, tractor moving from place to place. So this, I would say, was the third most important social protection measure which saved India from much of the adverse effect of COVID. So I feel that there are so many. We have many other social protection program also, but I find that these three are like flagship. Our public distribution system with buffer stock, our natural, our this Rural Employment Guarantee Act, which make right to work as a fundamental right kind of things, and thirdly, special exemption granted to agriculture sector so that agriculture activity does not get disrupted, have been important social protection measures and social protection policies during COVID time. So this is what I wanted to share, but I am also impressed by the example shared by Dr. Judy with us, and using these two cases, Professor Malhotra, I would like to say that generally there is a tendency among developing countries to go for collaboration, cooperation between developed country and developed world, between South and North. But if you look at the experiences of developed country may not be much applicable to developing country. So I'm very happy that you are having this collaboration with the Philippines. I feel that the scope of this kind of collaboration should be further expanded, and I really feel nostalgic that about 8 to 10 years back, I used to work with people in University of Philippines, Los Banos. So they have one center there, CIARCA. They also have Office of Asian Society of Agriculture Economics. So we used to share our experience in agriculture, global food crisis. So I find that your initiative is of that nature, and this kind of initiative need to be expanded in terms of their scope with Philippines and also with many other countries. So I'm here for another 7 to 8 minutes and feel sorry that I have to leave after that. So thank you very much for giving opportunity.
Thank you very much, sir. Thank you, Professor Chand, for this very, very insightful presentation and highlighting the policy strategies which India took in the light of COVID and responding and the responses towards that. Professor, with your permission, I would like to invite the insights and reactions now. But before I could get into that, I just wanted to make a small request to all our viewers to join the discussion by sending their questions through the comment section on the Facebook live stream. We will also take them up. We will take it with our panelists later on during the forum. And so with this, I'd like to just we'll first start with Professor Dr. Rosalinda's insights and response reactions, and then I'll request Professor Arvind Virmani for giving his insights and reactions to Professor Chand's presentation. So, Dr. Rosalinda, I'm sorry that we had to cut short your reactions a little quickly, and I'd ask you to please come in and make your responses to Dr. Judy's presentation. I think you're muted. You're muted.
First of all, I would like to thank PSSC and its Indian counterpart for inviting me to serve as a reactor in this very important webinar. I'd like to update the information about me so that, it's factual. I am Professor Emeritus because I'm already retired and I'm teaching at the doctoral program at the college which Judy and I share in memory, the College of Social Work and Community Development. And I'm no longer president of HomeNet Philippines, but I'm still in its executive committee, and I'm still active in HomeNet Southeast Asia, but I'm no longer the regional coordinator. But my latest engagement with HomeNet Southeast Asia is the participation in the ASEAN People's Forum, which just, concluded last week. And there was a huge convergence space on life of dignity, where social protection was the main topic. And COVID, of course, was very much the focus of the discussion as well as of the recommendations in the final statement. I would like to commend Dr. Tagiwalo for her presentation, which is very comprehensive, very up-to-date, and many of which, and most of which I agree with. But I would like to add more coming from civil society experience, because in the last few months, we have been monitoring the response and the initiatives of vulnerable groups to COVID at the grassroots level, and we do have data to support our observations. So I will organize my comments in terms of providing some descriptive dimensions of social protection as we understand it now. It should not only be universal, it should also be comprehensive, state-led and financed, gender responsive, sustainable, adaptive, and participatory. So when we say universal, we should think about the healthcare system principally, because if we look at the experience of countries, especially in Asia, the ones which succeeded in controlling COVID are the ones with very good healthcare systems that are publicly run and financed. And they have good monitoring systems that go all the way to the village or local level. So there was really enough incentive and enough resources to put into the COVID control initiative of government that was fully supported by the people through very effective information systems and campaigns, which did not happen, let's say, in the Philippine context, where government went on its merry way, imposed all the lockdowns, and, punished people who didn't have the resources to wear face masks or who, were forced to go out so that they can work and feed their families. So that is one, major critique. And then, of course, if we want a universal kind of response to COVID, the vaccine should also be free. Health care for COVID victims should be free. The medicines, the testing, and all that. Because swab tests in the Philippines can go as high as $150 if you get it from a private source. So there is now a debate as to how much should be the limit of the expense for COVID testing. I think Judy even went to the Supreme Court to really talk about universal testing, but then government, of course, didn't have an appropriate response. Secondly, I think we can learn from India because you have a rural employment guarantee program, which we don't have, a rural employment guarantee, NREG. Judy did not mention the fact that social protection in the Philippines also has this segment on labor market interventions, which are supposed to provide decent work and maybe more regular employment to people. But this has not really merited government support. If you look at the response to COVID, and if you look at how much was given to workers in the informal economy with whom I've worked for 2 or 3 decades, they comprise about 2/3 at least of the labor of the employed, and yet they only got less than about 300,000 individuals getting support from government. When we're talking about at least 25 million households that needed that kind of cash for work support. And then we also need to see the impact of COVID, not only on physical health, but also on mental health, on violence against women and children, which have risen very high during COVID times. And even reproductive health has suffered because hospitals have focused mainly on COVID, neglecting all the other services that are meant to be, regular for citizens, like reproductive health care for pregnant mothers. And we have now a huge rise also in teenage pregnancy. So when we talk about comprehensive healthcare or comprehensive approach, we need to see all the sides and not neglect the ones in the margins, like the PWDs, the senior citizens, who many of them don't have any kind of support. At least half of all older persons in the Philippines have no pension at all, no? So, and then during COVID times, their pensions were delayed and there wasn't much that was reserved for them. And as Judy said, if you look at the budget for 2021, all the items for health and social services went down. The ones for military and infrastructure spending went up. So where is state responsibility for social protection? I think we should really adapt, because in the ASEAN Declaration on Social Protection, it's very clear there that we need to adapt a human rights-based approach to social protection. And in that approach, the state is the principal duty bearer, and we as citizens are the claims bearer, the claim holders. And yet the state refuses to fund what is essential so that there could be health for all, social protection for all, education for all, housing for all, etc. And the reverse is happening. Instead of progressive realization of human rights by really adding more resources to social, economic, and cultural rights programs, there is less to go by. And if we look at build, where are the facilities for water, sanitation, and hygiene? Where is the budget for that? For those facilities that are essential for COVID control. So people can have clean water, they can wash their hands, etc. And so many of the households in the Philippines don't even have that. And yet there is no clear item in the budget that addresses that. And then my second to the last point is that social protection should be sustainable and adaptive. Because I once wrote an article for NEDA and the Department of Social Work, Welfare and Development about the need for climate-proofing social protection, encouraging communities to be resilient so that when we have typhoons like Ulysses, like Ondoy, like Yolanda, before, our communities will survive because they've already been capacitated to take care of themselves. But now that we have 24 major typhoons a year and everybody gets affected, we really need to focus on this. And with climate change, and we only have 10 years to go before this planet becomes uninhabitable, there is some urgency in putting more resources and focus on resiliency, on disaster risk reduction management, on adaptive social protection as an essential component of social protection systems globally. And last but not least, the social protection system should be participatory. Where are the people in all these initiatives? How are they engaged? How are they empowered? Because my experience monitoring what's happening on the ground is that people have taken a lot of initiative to produce food through the backyard gardening, through urban and peri-urban farming, agroecological farming, through community-supported and shared agriculture, because the principal problem is hunger. If you don't solve that, how can people work without food in their stomachs? So that ought to be one major track. And people who are already doing it in what we call social and solidarity economy initiatives, through cooperatives, through self-help groups, through fair trade groups, through social enterprises, they should be provided the support they deserve from government so that they can produce and provide for their own needs, principally food, and then they can also produce food and herbs as medicines, and they can also provide child and elderly care to be more gender responsive, etc., etc. So just to summarize, I want to round up my comments by saying that we are not doing enough social protection systems. Even the best social protection systems in the world are not, at par with the magnitude of the problems that are confronting us. And we can only solve these problems if we reimagine social protection as universal, as comprehensive, as state-financed and led, as sustainable, adaptive, participatory, and based on an overall arching human rights approach. Thank you very much for listening.
Thank you very much, Dr. Rosalinda, and thank you also for correcting the introduction. I'm sorry that we made this and updating us. Thank you very much for that excellent rounding up response to Dr. Judy's presentation. I'd like to now request, it's my honor to request Dr. Arvind Virmani to comment on and provide his insights and reactions to Dr. Chand's presentation. Just a brief introduction to Dr. Virmani. Dr. Virmani is the president of the Forum of Strategic Initiative and of Chintan. He has served as a member of the Technical Advisory Committee of RBI on monetary policies and has also been and is also a mentor of public policy with the Federation of Indian Chambers and Commerce, He was, until the end of 2012, the executive director at the International Monetary Fund, IMF, Washington, and has been an ambassador of India to the IMF in Bangladesh, representing India. He has also been an advisor to the government of India at the highest levels for 25 years, and has included his advisor as chief economic advisor to the Ministry of Finance and principal advisor Planning Commission. During this period, he advised on a host of economic policy reforms and was chair of committees on public debt management and customs duty reform, as well as member of various committees contributing to over 100 policy papers and notes. He also served as a member of the Telecom Regulatory Authority of India and the Appellate Tribunal for SEBI Act, chairman of the Board of Trustees of the State Bank of India Mutual Fund, and the director of the board of several financial institutions in India. He has published a number of papers and has written a number of books in the areas of macroeconomics, growth, finance, international trade and tariff and international relations. It's our honor to have Dr. Arvind Virmani here with us and provide his response to Professor Chand's presentation. Thank you, sir. Please, the floor is yours.
Yeah, thank you for your introduction. But slightly, I think it's 2 years out of date. I'm currently only the chairman of the Foundation for Economic Growth and Welfare. Some of the other things are kind of...
I'm very sorry for this.
No, that's okay. I think the ICSSR needs to update its biodata. Anyway, that's incidental. Yeah, so what I'm going to do is Professor Chand, an old friend of mine, who has given the, I think, focused on the immediate response with respect to the pandemic. And I'll kind of put it in a kind of longer term perspective. So basically, I think it's important to understand that India is coming from India till, let's say, 4 or 5 years or so ago. India was a low income country, and Philippines, of course, has been a middle income country for a much longer time than India has. And therefore, our welfare focus really, historically has been on poverty alleviation. India was the first country in the world in the 1960s to talk about poverty alleviation. And we built up a number of multiples of programs for so-called poverty alleviation. Now, in 2009, we did a study which showed that just the 3 largest poverty alleviation programs in India were had enough funds in it to completely eliminate poverty. So that a new approach was needed. So what was the problem? We kept building these programs for different aspects, different categories, different geographies of poverty, and I kept piling them up, and a new view was needed. So in our paper, which was published in 2009, we said that we should now start thinking of poverty elimination rather than alleviation, which was founded on the belief that growth will take a long time to eliminate poverty, and therefore we needed to alleviate it. So we said you have to shift. And one of the proposals which I made in that paper was that we needed a universal ID to which all these welfare programs, because there were so multiples of these programs designed to do more or less the same thing, we needed to integrate that. And the only way we could do it was to have a unique ID and link it to all these programs. So we proposed what was called the unique ID system, and I also happened to chair the committee later, which approved and put this into operation or to the government, and it was later re-christened Aadhaar. So this system has been built up. Now this is very important, and on top of this building happened from something like, of course, it was set in motion earlier, but it really got going in 2014 or so. And on top of this, there was a big effort at financial inclusion. So, and some linkage between these two numbers. Sorry, not number, the unique ID and inclusion. Now, what was the inclusion problem? I don't remember the numbers exactly, but to give you an order of magnitude, before this financial inclusion program, roughly 30% of the adult population had a bank account. And after this effort, more than 90, in some cases 95, 98% of the public got bank accounts. So it was really a massive effort, which then linked Aadhaar numbers to these bank accounts. So, and what that allowed us to do was to start what was called a direct benefit transfer. So some of these things, just to give you one example, the scholarship program, it used to go through multiple bureaucratic channels, to get to individuals. All this was integrated into a direct benefit transfer. So and then similar things were instituted in different parts of this enormous welfare system. What our goal now is a direct cash transfer system. Again, this was part of that committee which I headed. We proposed, one of them, there were two of them actually. We proposed to integrate all these programs and combine it into a direct cash transfer. And I say this not just as a general, you'll see how important the pandemic. So let me move to the pandemic. And the pandemic actually brought home to us that if we had already had this system in place, it would have been a big help. Let me tell you why. Now, what was new about the pandemic? Of course, we've had a public health system, from the ground, from what Professor Chand, member Chand talked about the panchayat level, the ground level, primary health centers, secondary health centers. We have an enormous public health system, but the quality of that system has deteriorated from the first time it was set up. So it's not very effective, but it is there. Now, and various things have been done on that. I don't want to get into that. But there were two things new about the pandemic from my perspective as an observer and a researcher on this issue. One was that, most of our, Professor Chand already told you that the food PDS system was universal, but the work system was really directed at the rural. So what the pandemic was unique in the sense that there was a fear that this contagion will be higher in the urban areas because of the concentration of people. And therefore, this was a new thing. We required, and we learned for the first time, the migrants, because they didn't have a job, because they feared pandemic, because of the fear of pandemic, jobs went down, economic activity went down. And then because of lack of jobs, they started thinking of going back home. So this was actually a new problem. We've never seen this before in the 70-year history of India. So that was a unique feature of the pandemic. Now, as I said, if we had a DCT, one of the things I proposed, I wrote several papers, one of them Professor Chand mentioned. And one of the things was that we said that we should accelerate the direct cash transfer system because this problem of migrants would have been taken over. If all the poor, let's say the bottom 50% of our population, which is still relatively poor, it's not, extreme poverty, which perhaps is down to 5% to 10% level. But the bottom 40% of the population is probably still relatively poor. So if we had a direct cash transfer system in place with the UID, the Aadhaar, what we call now, number, then what we could do is we could have directed these cash transfers directly to all adults below that 40% level. And we would have been able to get it separately. For example, migrants' family, the definition of, by definition, most of these migrants have their families still in the village or rural area. So if you have a DCT system which can give money to each of these, we wouldn't have had this problem of movement. Because during the movement, there's uncertainty. Is he in a rural area? Is he in an urban area? Neither, right? But if you had a direct cash transfer system, which was also linked to the mobile, which is another thing which I have been proposing for the last, since that 2009 paper, you could have transferred money right into the hands of the person, whether he was in the urban area, whether he was moving by train or through a mobile wallet. So this is really, in some ways, in my view, I'm not sure how far the government itself is on this view, but at least I have been recommending, and hopefully there is increasing recognition of this, which will come and hopefully implemented. It's something which Professor talked about empowerment. The way I look at it is this is the biggest form of empowerment because there's no intermediary, no bureaucratic intermediary. You get the money The poor person, he doesn't have to run around the ration shop. Sometimes the ration shop is out of food. And Narega, sometimes the thing is fulfilled. Sometimes there's a delay in receiving authorization for the program. There is a whole bureaucracy of work creation. It eliminates all this and puts the money right in the hand, right, literally in the palm through a mobile phone. So this is, in my view, is the direction where India should go. And probably, I'm not sure to what extent it applies to the Philippines, but I'm pretty sure this is the best way for 90% of the, at least the lower, up to the lower middle income countries where we still are, though of course that category has been eliminated, then the only middle income category to which we belong. So with that, let me stop. Can continue Q&A. Thank you.
Thank you. Thank you so much. Thank you so much, Dr. Professor Veermani. We can now open the forum for our participants to join in the discussion we can have. And if there are any questions from our participants, please send them. You can send your comments by on the section which is on the Facebook live stream. You can also direct your questions to the speakers or to the or any specific panelists. So please let us have the questions. There's one question which has come from which is for Dr. Veermani, which talks about is that he has mentioned that there is an approach of for eliminating poverty instead of elevating poverty. Does the Philippines share the same mindset or approach?
I think the Philippines people have to respond to
John. Yeah, that's from Dr. John Cruz.
The Philippines participants would have to respond. I don't know enough about Philippines. Yeah,
I think I could request the Philippines, Doctor, to please. You can start the discussion if you want, Dr. Porteous.
Dr. Judy is there. If she wants to respond to this question, she could respond.
Yeah. Okay, Dr. Right. Judy also can.
I think we're still in the frame of poverty reduction or poverty alleviation. If we talk about poverty elimination, then you have to have major structural reforms. You know, the issue of local industries, the ending dependence on an export-oriented, import-dependent, debt-driven development trust, which is still, you know, what the development trust of the various governments have been. So, no, unfortunately, while we would wish with all our hearts to have poverty elimination as the goal of every government, it isn't so in the Philippines right now.
Thank you, Dr. Judy. Have we got any more questions from the Facebook? That's if the PSSC team has been able to collect those questions. Have you been able to collect any questions that have come on the Facebook? And you can send it out here to the Zoom for us to ask our panelists. I think we are not having anything. I would like to, the panelists, if they would like to give a few few comments before open your thoughts up and give some reflections, or are there any questions there from this?
So let me just indirectly then answer the question, and before I leave, I think Professor was quite right that when we are talking about poverty elimination, one element is what I said, the direct cash transfer, but the other is structural reform. She is very right. So I just want to mention that actually it connects to the what Professor Chance referred to my paper. Really, what we are now actually focusing on is the post-pandemic situation. Of course, there was the direct stuff which we addressed in this meeting. There is a fiscal and monetary policy issue. And then we come back to the old structural issues of how to accelerate growth, economic growth, GDP, employment, etc., etc. We have also written about that. It's on our eGrow website for those who are interested. Basically, I mean, to put it a little starkly, I think the government, our government has recognized this. And since the first initiative of the corporate sector, corporate tax reform around August of last year, there have been a slew of structural reforms, which are basically designed. They are still in process. About, I would say, 60% have been done. There are still 40% which are in process, which I believe will set, let's say, after normalization. So fiscal and monetary policy is very important to go back to some kind of a normal, where I define normal in terms of the, GDP, let's say a year ago in the same period. So if we are talking about a normal quarter, we are saying, okay, is the GDP back to what it was exactly a year ago in the corresponding quarter? Or if we talk month, we are talking about the corresponding month. So what we have predicted is that normalization in India will occur by the fourth quarter. Of course, this is a topic for your next debate, but what we have predicted is that normalization will occur in India by the fourth quarter, and there are now signs that it may even happen by the end of the third quarter. But here we're talking about our financial year quarters, not the calendar year. We have a financial year. And after that, this structural reform will come into play, because before you are normalized, really they have little effect. Whether it's tax reform, agricultural reform, labor reform, whatever, they'll have very, very little effect, positive or negative, before normalization. So we are setting it up, these reforms, if they are completed, the list of reforms, we hope to be back on the growth track by next year. And that's one point. The second point is one has to be a little careful about when we are talking about poverty. Our focus, as I said, has been on what is now called extreme poverty. So the issue of redefining poverty for a middle income country, which is in process in India also, will involve different issues than the poverty alleviation debate we have been having. When we said top poverty elimination, we were really talking about extreme poverty. So in that sense, new issues will arise, and we keep looking at policy adjustment. For example, just to give one example before I conclude, the public health system is there, but the government over the last 5 years has built in some disaster insurance. So if there is an extreme health event, like a cancer problem or a heart problem or an extreme event, there is an insurance system being set up for the poor. So as we go along and as the extreme poverty is eliminated, new issues arise. And of course, these have to be continuously addressed. And fortunately, our current government is aware of this. And of course, there are financial limitations, there are budgetary limitations which have to be kept in mind. But within those limitations, I think in India, we are thinking and working on those issues.
Thank you, Dr. Virman. There's one more question. I think I could put it out to you, sir. The question is: Can we discuss something or talk about digital pension and how successful or problematic it has been in India? So there's a question that I think, sir, I think you could respond to this.
I think it's not actually gone far enough. In fact, this mobile. I first became convinced about using direct cash transfer and connecting it to the mobile phone was when I read about a South African system, surprisingly enough, or a South or East Africa, I think either Kenya or South Africa, where they very early, about 10, 15 years ago, started giving government pensions directly into mobile phones. This was a big innovation in the use of mobile phones. I think if I remember, my dates are now getting a little hazy. I'm getting memory, but I think it was almost 15 years ago. And I don't think we've still done that. We are actually, even our government pensions are coming to the, so it's more DBT. It's really linked to the bank account. They are being paid directly into the bank account rather than through a check or anything like that. So it's really not digital. So and really the big benefits of DCT connected with mobiles comes in rural areas, because in urban areas the concentration of bank branches is pretty high, so it's not necessary. But you know, in a rural area in Rajasthan, the closest bank branch to a village could require a day's trip from. And I know of people who live in Rajasthan who have told me this personally, that it could take a day trip to go to the branch and come back. Now, of course, we have instituted this new system of correspondence where the bank, somebody intermediary goes to each village periodically, but still having the pension or the welfare transfer coming directly to you in the village on your cell phone, where you can then mobile wallet you can use for every purpose, you know, instead of having to go to the bank or withdrawing or waiting for the correspondent to come to your village, is really would be what I call real empowerment. And that is what I think we need.
That's a very important point, sir, because it's really empowered the rural more. It's been more effective in the rural areas and empowered them. There's one more question. I think it could have been it was meant for Professor Chan, but since he has left, I'll leave it to you, sir, to respond. The question is about regarding the PDS and the food distribution system. Have we seen these programs evolved with the passage of time, or have they remained largely the same? The question is about the PDS system. And do we think the system has changed? Has there been any institutional restructuring in this way?
So the PDS system has not really evolved much. The only addition about 10 years ago was that instead of giving a steady price based on the procurement price, a special window was opened for the very poor, which gave it at near zero price. So even below the procurement price or the way before cost. So what that proved useful in the pandemic was that government, given that there was stress among certain parts of the population, gave a quota of completely free food. So the really poor, you didn't need to starve. Even if you had no job, you had no savings, you could at least go to the ration shop and get the wheat or rice completely free up to a certain limit. So that's a system which has, if you want to call it, evolved. Yes, but the rest of the system hasn't really changed much. And I would agree, if that was your indication, that there is scope for reforming this. For example, one of the ways to do it would be to integrate it into that direct cash transfer, where the implicit subsidy is actually paid to you through your cash transfer, and you the poor person can then choose. It doesn't have to go to this one ration shop which is available. It could go to any supplier of foods and buy the provisions. So that's a direction in which is possible, but it's not on the cards as far as I know right now.
So if I may just add on to one more change which is seen in the food system, supply system, to what Professor Virmani has added. If I could just put one more question, sir, there is also there's been a slight some institutional restructuring happening within the food distribution system, that there's more procurement focus from the local farmers at the local level, local procurement, and also there is also, as you have pointed out, the ID, the unique ID, Aadhaar link to getting the PDS. So to some extent, some changes have been made to deal with the leakages that are happening. So that's a structural change that is happening. But as you rightly said, the food part is not much.
And I agree. The leakage part is correct. Yeah.
Yes, sir. Yes, sir. There's one more question regarding the Narega.
Professor Madhushri,
Yes,
just
sir.
one more addition to what Professor Virmani had just said. As far as evolution of the
Yes, sir.
PDS
Yes.
is concerned, the targeting has definitely improved. I remember that when it was renamed as Targeted Public Distribution System, what kind of things were happening at the level of the intermediaries, and also identification of the beneficiary population in terms of APLs and BPLs, and having different price structure for different kinds of population. That's another thing. And within BPL also we have the population which is termed as, or for which the benefits are termed as, something like Antyodaya, that is the last of the BPL families. That's one thing. And secondly, the recent changes in agricultural, marketing system. I think since the markets in days to come are going to be more opened up, in fact, and so that would definitely give a little more protection to small and medium farmers, in fact, where they can dispose of their surplus and have a better price. So I think this is how public distribution system is expected to improve in days to come. Thank you.
That's really very important point, sir, because local procurement will get strengthened now, sir, because if the farmers can dispose it at the local level. There's one question here. I think it's for our Indian speakers. I think it could be for both Professor Malhotra and Professor Virmani and anybody else. That do you think the employment guarantee program, can it be recommended for setting up as a guaranteed employment program in other countries such as Philippines, given the huge unemployment and underemployment that has been seen in the light of COVID? It's a question anybody can pick up. I think, sir, you're
Professor
muted.
Virmani, would you like to respond to that, or should I?
Go ahead, please.
Please. I mean, there are two things that I feel like, because implementation of a scheme like Narega would definitely need immense amount of resources at the country level. Whether a country can manage those resources to implement. I remember there was a big debate in India also when Narega was being thought about. And in the recent past, during pandemic times, we have seen that there has been a wage revision also within Narega. So, which means that it would always need a very big amount of resources. So, would depend upon the entire financial system, or let's say the fiscal system in a country, whether they can mobilize those resources through any kind of means or not. So, largely this question rests on that, in fact. And I was very happy to see that the way the figures related to underemployment were also discussed. And just to add, so employment, we used to see employment situation, whether it is cyclical in nature or structural in nature. But even relatively small-sized economies have this important concern. And I know that number of people in the recent past, including those who have bagged Nobel Prizes, they have written about slightly changing position of employment or unemployment, even in the very highly developed economies. Because technology, even the economies which are heavily dependent on industry, there also technology has definitely led to little causing of unemployment in those economies. I do not know, because there is always a time lag between the skill levels in an economy and the level of technology in an economy. And this is why normal expectation has moved to a point that economies shall continue to suffer from some degree of unemployment even in days to come. So that is where, because otherwise we need to have skill developing at the same time at which, or at the same pace at which, the technology in an economy is growing. So these, I think, are very important issues and need to be understood in proper perspective, and also looking at the resource availability and the fiscal flexibility in a system. I think these are important issues.
Thank you, sir. Thank you very much. I think we have done with our open forum, as we don't have any other questions. Would like just like to open up for the speakers to give any of their final thoughts or any reactions that they would like to give before we move into the final synthesis of the program.
Okay.
I think
I'll
Professor Virmani would like to leave. I think he wants to leave. So I think he has left. I'm not sure if Professor Virmani is there, but I think he's left. So I'd like to give a final reactions and thoughts. Professor Judy, please.
Yes, thank you so much for this opportunity to dialogue with our colleagues in India about a very important matter in our lives today. I think, well, the next webinar will be talking about economic stimulus and recovery. I would just like to highlight the fact that I hope that the new normal that we're going to enter won't be the old normal with just more stringent health aspects. You know, the old normal was really about growth, but in many countries it was jobless growth which did not benefit the majority of the people. So I'm really hoping that that our colleagues in the university will be able to assist the grassroots demands for better social services, to highlight the role of government in providing these social services, a trend which has been overturned by the privatization before. And two would be the need to ensure that local economies are strengthened, because we have seen globalization under conditions of pandemic would really have a strong impact on how our economy, which is dependent on foreign goods, would be affected. So I hope the new normal will be better for the majority of our people. Thank you.
Thank you very much. Any other reactions? Any other thoughts from the speakers? Dr. Rosalind, would you like to say something, or Professor Malhotra, would you like to make some?
I would like to say a few words.
Please.
Okay, sorry, I couldn't get the picture.
To unmute immediately.
Yeah.
Well, I would like to echo Dr. Judy's reflections.
A little louder, we can't hear you. Your voice is
I would like to echo
low.
Dr. Judy's reflections, but I also have this very, very clear insight that there are so many parallelisms between India and the Philippines. We both are under a development model that really, does not obligate government to really be siding with or providing for the people. And maybe with academe and people's organizations, civil society organizations working hand in hand, we can stress that point more strongly, because without that factor, we cannot have a better new normal. We need to really move so that resources will be there for social protection and other services and programs that will benefit our people and that will reduce inequality, eventually eliminate poverty, and result in transformational change that will also factor in the survival of people and the planet in a post-pandemic world that still has to deal with the climate emergency. So thank you again for accommodating our opinions in this important webinar.
Thank you very much. They're really very important opinion. Thank you. Any other comments from anyone? Last comments and reflections? From ICSR, would you like to say something, Professor Malhotra, sir?
Just one thing to say, that there are a number of issues which used to be specific to few economies, in fact, and they are becoming still more common. So unemployment is one such issue which is becoming common and which is not specific to, let's say, relatively less developed economies like India, but is definitely to a large extent now applicable to even middle income economies and advanced economies, be that of a structural nature or cyclical nature. Irrespective of that, I think in days to come, with technology moving an inch every day almost, so changing every day and skill levels being relatively not in a position to match the level of technology on a day-to-day basis. So I think the talk about unemployment will continue. That's one thing. And secondly, poverty-related measures. As I said, I was very happy to see the way underemployment is being measured in Philippines. I think there is no such statistics right now in India. So we would like to work on that. There are estimates, but it is not exactly done the way it should be done. That's one thing, because the definitions of employment, they differ, whether it is 8 hours a day or 4 hours a day or 2 hours a day. So based on that, the entire measurement is done. So that's another interesting aspect. And I'm very happy to notice that when our Philippine expert, they did say that from Narega-like scheme, the kind of big schemes that India has launched, Jan Dhan being one, Narega being another one, Mudra being still another one. These are the schemes where we definitely need to talk to the rest of the world, and maybe they have certain things to learn from us. And we also, as I made a mention about measurement of underemployment, we also have certain things to learn from them. So overall, it's a good learning experience for all of us. Thank you very much.
Thank you, sir. Thank you very much. Dr. Porteous, would you like to make your final comments? Anything?
Yeah. Well, the picture that was painted for India and the Philippines is somewhat bleak.
Little louder, doctor. Little louder. Its voice is very faint.
There's a strong rain here. That's why. Anyway, as I was saying, yeah, the picture that was painted for India and the Philippines, more so in the Philippines, is bleak. So it makes us ask the question, what has been our government doing, in connection with all of these typhoons, earthquakes, and the COVID-19. But even if it's bleak, I can see glimmers of hope because we still have the academe, the civil society organizations who are really honest in their in their attempts to really help the vulnerable groups. We've seen this now when Taal volcano erupted, when typhoons Ondoy, Typhoon Ulysses, and the recent typhoon came, as well as the COVID-19. Our government was not really quick in solving our problems, but we have civil society organizations and the academe who really took time to campaign and to mount their own donation programs to be able to help the poor and the vulnerable groups. So while there is a government that is neglectful, I can see hope, among us, among the civil society organizations and the academe, that we can still do something about this. Well, in the Philippines, the election is fast approaching, and maybe we can change leaders. But again, it's not the thing that will make the Philippines now become more progressive, because those who will be elected will be probably similar, but still, I'm hoping that there will be civil society organizations and academic institutions will make our government see, the need for them to step up and really help our most vulnerable groups. So that's all.
Thank you very much. Now we just before I put in the conclusions here, I'd just like to add a few comment sentences of my own to this wonderful discussion that has happened here. It has been my honor and pleasure to be a moderator for this discussion, the rich information that was shared by the speakers and the reflections that came up from the bit. 2 or 3 takeaways that I took from this discussion was that, yes, we have had many safety net programs. Our countries have been working on that, and our approaches, though, have been different, but efforts are being made. While we have a lot of work that has been done from the government in India, in Philippines, the efforts are more driven by the civil society groups. But the important points that came out, that COVID has brought us attention to rethink and focus on a couple of things, which was brought out as how we can deal with issues pertaining to public health, issues of employment, and issues regarding making food available to people. And in this process, it also made us think that safety nets, now we have to talk about safety nets, is thinking and providing and strengthening the institutional structures for reaching the last mile, so that the people at the end, the ones who are supposed to receive the benefits of safety nets, get them. And that's where an important suggestion that came out from this discussion was, how do we think about and focus on adaptive social protections problems, social protection schemes, and that are responsive, that are resilient, and that are dealing with sustainable development concerns. So these are some very important takeaways that has come from this webinar. I'd like to now just get into thank all the speakers who were and have shared their times and their thought in this webinar. Dr. Judy, Dr. Ramesh Chand, Dr. Rosalinda, Dr. Arvind Virmani. We'd also like to thank all the officials and the staff of the Indian Council for Social Science Research, and also the Philippine Social Science Council, led by Professor Malhotra and Dr. Porteous, for making this webinar possible. Let us take this opportunity to invite everyone because this is going to be a part of a series of webinars. So the 3rd webinar is soon going to come up, the 3rd and the last one under this. So the focus would be on the narratives of the COVID-19 from the social science communities in India and Philippines. Would like to share this information and request all to join with us with this program, and follow on the Facebook and the websites of Philippine Social Science Council and the Indian Council for Social Science Research for more information on this regard in this upcoming webinar. Also, we'd like to thank, most importantly, all our webinar participants, especially those who asked all these important questions and made us think and reflect on the safety nets that we have, and how do we take ourselves and work forward and move forward the steps ahead. Like to request everyone to help us briefly with an evaluation from us to help us further improve this webinar that we are doing. The link for the evaluation form is flashed on your screens and is posted in the comments section. Please note that those who are able to submit the evaluation form will be given certificates of attendance. Those of you who are attending this workshop webinar, the evaluation will be open till 5 p.m. That is the Philippine Standard Time, and 2:30 p.m. the Indian Standard Time. Lastly, but not least, all the webinar participants, those recording or will be available shortly here on the Facebook and on the websites of both ICSSR and PSSC. You may also share all the information with your friends. And thank you very much, and thank you, and have a good day. Thank you very much.
Thank you very much, everybody.